Let's bring in ABC's chief medical editor, Dr. Rich Besser. Doctor, you've had some misgivings about this mandatory quarantine, but the fact that this nurse, while she did test negative, did spike a fever, doesn't that in some way vindicate the policy?
I don't think so. I mean, people will come back from travel and develop illnesses, but she didn't have Ebola, and I think the system was working. You see pictures of Dr. Spencer all around town, and it makes people uncomfortable. But he was not contagious until after he had that fever, and so the policy worked. He got in isolation before he put anyone at risk.
Well, we do have some good news on the Ebola front this morning. Some new pictures of Nina Pham, the nurse from Dallas, returning to her home in Dallas after she got out of the hospital yesterday in D.C. Before she headed back to Dallas, she got a hug from President Obama. It's interesting, and there you see the hug. It's interesting that we're seeing so much success in treating Ebola patients here in the U.S., most of them surviving. However, that is really not the case over in Africa.
It's not. I mean, those photos were just incredible. But the World Health Organization just announced that there have now been more than 10,000 cases of Ebola in West Africa. More than 50% of people who have that infection there have died. We need to understand why here in the U.S. we're now treating our 9th patient. Only one person here has died, and that person got late treatment. What can we learn from that and apply to Africa? I am concerned, though, that these quarantine rules will discourage some Americans from going over there to help, and we need to do all we can here to knock it out there. That's what's going to make us safer here in America.
And just to get back to Nina Pham for a second, with the president giving her that very high-profile hug, do you think he's trying to send a message here?
Oh, he's sending an important message that once someone recovers from Ebola, they're not contagious. Not only are they not contagious, but they're immune. So there's hope that some of these people who've recovered around the world can become future caretakers for those people who have the infection, and that might help.
Dr. Besser, it has been great for us to have your calm, steady, and experienced voice throughout this coverage. We appreciate it. It's an asset to us and our viewers. Thanks.
Thank you.
Appreciate it.